In the aftermath of the Navy Yard shooting in D.C., there are still a lot of questions about the gunman. Last night, we told you Aaron Alexis had a history of psychiatric problems. He suffered from paranoia and claimed he heard voices in his head. His father also says he suffered from post-traumatic stress disorder, PTSD. Investigators say he sought treatment at a nearby VA hospital. Now members of Congress are asking how Alexis, given his mental health issues, was able to keep his security clearance. 10 on your side's Lauren Compton posed that question to Senator Mark Warner today. Lauren?
Nicole, Senator Warner says that this incident at the Navy Yard shows a need for improvement in mental health services for people in the service. But he warns we need to be careful on how we make those changes so we don't create an even larger stigma on mental health. The mental health of a man who gunned down 12 people and injured 8 at this Navy shipyard is now under the microscope. A report shows that the shooter, Aaron Alexis, had a history of hearing voices and insomnia, symptoms of mental illness that were apparently reported to the Navy but never acted on, or had an effect on Alexis' security clearance. Lawmakers like Senator Mark Warner say clearances should be checked more often to catch potential problems.
He had a security pass, then he left employee of the government, and there was no revetting. So perhaps, how long you get a security pass without a revet is something that ought to be examined.
Alexis had his clearance since 2008, good for 10 years. Senator Warner told 10 on your side something needs to be done to prevent sick individuals from having security clearances. But when it comes to limiting clearances for people with mental illness, the senator urges caution.
But I also want to be sensitive to the fact that there's an awful lot of brave men and women who've returned from Iraq and Afghanistan who have had challenges with PTSD, and I don't want them to underreport or not feel like they can get the kind of services they need because that might restrict their ability to get employment.
The Joint Chiefs General Martin Dempsey spoke on mental health concerns in a press conference today. Dempsey said he doubts that questions about mental health on a security clearance form would have revealed Alexis' mental problems. Now again, Alexis reported he was being treated at a VA facility. We asked Senator Warner if that shows that changes need to be made there as well. Warner says he doesn't want to weigh in on the VA's role in this case until he has seen all the facts and how Alexis was treated. In the newsroom, Lauren Compton, 10 on your side.